have a Saunders test. Make sure you get into the bicipital groove. Go ahead and make sure you've got it. Go ahead and abduct the arm to 150 degrees. Go ahead and externally rotate. And then all the while you're checking that bicipital groove, and you're going to go ahead and bring the arm back down. Okay, after the scratch test, you're basically going to ask the patient to go ahead and take this arm and scratch this scapula. You want to make sure that they can reach that over to their scapula. Then that same arm, bring it down and then come up and touch again the scapula. And if you're looking for any rotator cuff pathology, and it's a bilateral test. Okay, apprehension test. You're going to bring the patient's arm 90 degrees, and then into this position, just flat hand. You're going to go ahead and try to bring them into external rotation. You're looking for any apprehension, and this is a bilateral test. Okay, bring the patient 90 degrees. All the while you need to make sure that you're in the bicipital groove. Best way is go ahead and get some motion in there. Then you're going to externally rotate and internally rotate. You're looking for integrity of the glenohumeral ligament, and this is a bilateral test. Bryant sign. Basically going to take a look at the patient's back. You're going to note the axillary fold and make sure that they're even. Neither side is dropped, and this is a simultaneous test. Okay, Codman's drop arm test. As the doctor, you're going to go ahead and have control of the arm. Bring the arm passively to 150 degrees, and you're going to kind of monitor to make sure it's fluid. Let the patient take control and drop it back down, and you're watching for fluidity of movement, and this is a bilateral test. Alright, the Barnes test. Go ahead and find the subacromium bursa and take and flex and extend, and then go ahead and bring it, abduct the arm to 90 degrees, and it's a bilateral test. Okay, Dugas test. You basically think of do good, pat yourself on the back, so you cross their arm, they grab their other shoulder, and then bring their shoulder down to their chest, and this is a bilateral test. Okay, for Hooter sign, you're going to go ahead and ask the patient to bring their arm into at 90 degrees, and then you're going to ask them to go ahead and flex, and you're looking for the bicep to ball up, and this is a bilateral test. Okay, for impingement sign, you're going to ask the patient to flex their elbow, go ahead and rotate their, pronate their wrists so they're not punching themselves in the face. Go ahead and grab the elbow, and you're going to bring it into all of the ranges of motion, and you're going to bring it posterior all the way through all of the ranges of motion. Looking for any pain in that range of motion, is a bilateral test. Okay, posterior apprehension test. Take the patient's arm, put it in this position, and then you're going to go ahead and drive it across, just a little bit across the midline of the chest. Take your other inferior hand, get a hold of the scapula, and then you're going to follow that line of drive and push posterior. You're looking for any apprehension of the patient, and this is a bilateral test. Okay, scapulothoracic rhythm. What you're going to do is you're going to find on the scapula inferior medial border with your grease pencil. You're going to go ahead and make a mark. You ask the patient to raise their arm to 60 degrees. You want to stop the patient at the 60 degrees. That's a good idea. And then ask them to go ahead and move to 90 degrees. probably want to use your opposite hand while doing it so that you can monitor that grease. Go ahead and 60 degrees and then 90 degrees. And you're going to note the degree of change. The change should be a 2-to-1 ratio, and this is a bilateral test. Speeds test. You can go ahead and palpate for the bicipital groove. Once you've got it, ask the patient to bring their arm out. Hand is supinated. As the doctor, you're going to go ahead and resist and ask the patient to flex their arm while applying resistance, and you're going to feel for any change in the bicipital groove or any pain that might be created at that point. And this is a bilateral test. Okay, subacromial push button sign. Go ahead and find that subacromial bursa. Bring the patient's arm, once again in the same position most of the tests are in. You go ahead and flex and extend, all the while noting any tenderness at the subacromial bursa. And this is a bilateral test. Okay, supraspinatus arc test. With the patient's hand in pronation, flush against their side, you're going to apply a little bit of resistance, just enough so that the patient knows that there's resistance there, and the patient's going to take active control, and you're going to go ahead and have them raise it all the way to 120 degrees while applying that resistance. Between the angle of 0 and 20 is going to be supraspinatus, and then again from 90 to 120 is supraspinatus. If there's any jerking between 20 and 90, then you're going to be thinking deltoid pathology. But because it's the supraspinatus arc test, you're actually looking for the supraspinatus, and this is a bilateral test. Okay, supraspinatus test. You're going to have the patient abduct their arms. Good just to have their thumbs pointing down at the very beginning. Apply downward force, then bring their hands to 30 degrees and apply downward force. If they have weakness in the 30-degree position, then it's a supraspinatus pathology, and it's a simultaneous test. Okay, Terry's test. Basically all you're going to be looking at is looking at the patient's position and looking for their palms, any kind of rotation. If their palms rotated posteriorward, then you're going to be thinking that you have a Terry's major spasm, and that this test is done bilaterally. Okay, transverse humeral ligament test. Make sure you get the transverse humeral ligament. Bring the patient's arm into abduction. You need to ensure that the elbow is extended fully, and then you're going to internally and externally and internally rotate the arm. You're looking for any clicking or popping in the transverse humeral ligament, and it's a bilateral test. Okay, Yergason's test. Go ahead and palpate the bicipital groove. With the patient's hand in pronation, in a handshake position, completely flex the elbow. Then you're going to supinate the hand and externally rotate. And you're looking for any tenderness in the bicipital groove, and it's a bilateral test.